The Council of Governors has ordered immediate stoppage of salaries for all striking medics and further wants county governments affected to begin advertising all positions. This as Health Cabinet Secretary Mutahi Kagwe faulted the striking healthcare workers for what he termed as abandoning Kenyans in the middle of a pandemic. The strike by nurses and clinicians is in its third week, while doctors joined in on Monday, decrying lack of protection by the government as they lead the fight against the coronavirus pandemic. Purity Museo begins our live coverage now.
It was the most anticipated press briefing which brought together officials from both the Ministry of Health and Council of Governors. Kenyans eagerly waiting to hear what the two levels of government would say concerning an ongoing strike by healthcare workers.
I was trying to Google and find out which other countries this situation is pertaining. And to my utter surprise, the only healthcare workers that have gone on strike during a pandemic situation are the Kenyan healthcare workers. It's sad.
Health Cabinet Secretary Mutahi Kagwe saying that most of the demands by medics had been met and it was only fair for them to resume duty.
It is therefore regrettable that some health workers have chosen to down their tools and deny innocent Kenyans the much-needed health care service at this time of COVID-19 pandemic.
He said it was insensitive for the medics to boycott work at a time when the world was in the middle of a pandemic. To address the crisis in the healthcare sector, the Council of Governors has resolved to sack the striking medics and replace them in what they term caring for the sick Kenyans.
We will endeavor at both levels of government to ensure that we do not abandon Kenyans by recruiting and replacing striking staff with other healthcare workers who are seeking employment in order to ensure that we provide continued service in all our public health facilities.
We thank those health workers who are still working. We sincerely thank them, and we urge them not to join the strike. We urge them during this season of festivities to be together with the other Kenyans and to help us as we're moving forward, and that as county governments will try our best.
The medics are protesting lack of medical insurance as well as adequate personal protective equipment, saying that many of their colleagues were dying from COVID-19 due to a lack of both protective gear and health insurance cover. In Mombasa, healthcare workers would Monday camp outside the Mombasa governor's office to compel him to listen to their grievances. Led by their Secretary General Peter Maroko, the frontline soldiers vowed not to relent until their demands are met.
He has not bothered actually to address any of our issues, and we are going to stand strong until that day the governor and the county government of Mombasa are able to address our issues.
While health services in public health facilities in Uasin Gishu County remained paralyzed for the third week as nurses and clinicians continue with their industrial action, the workers here decry lack of promotion of their members for more than a decade.
It's surprising that this is the only county that has not promoted the staff. Some staff have stagnated for over the last 10 years. Those who are due for promotions, we are given lame excuses on the issues of budgetary constraints.
While the Ministry of Health and Governors insist that the striking healthcare workers must resume duty immediately or face the sack, it is a 50-50 situation on whether these medics will heed to these calls, considering they have already vowed never to return to work until their demands are fully met. Purity Museo, Channel 1 News at Afya House, Nairobi.